Which ribosomal subunit is the primary binding site for tetracyclines? 30S subunit. Remember, tetra ties to 30S. Which aminoglycoside is preferred for multi-drug-resistant tuberculosis in India's DR-TB program? Amikacin. Remember, AMI kills MDR-TB. What serious adverse effect common to aminoglycosides necessitates baseline and periodic audiometry? E. Ototoxicity, hearing loss. Remember, amino attacks auricle. Speak as if increased. Which macrolide inhibits cytochrome P453A4 the least and is therefore preferred when using statins? Azithromycin. Remember, azith avoids KIP, chaos. Gray baby syndrome is associated with high blood levels of which antibiotic? Chloramphenicol. Remember, chlor turns baby gray. Which lincosamide antibiotic is notorious for precipitating Clostridioides difficile pseudomembranous colitis? Clindamycin. Remember, Clinda causes colitis. Linezolid is primarily bacteriostatic but becomes bactericidal against which pathogen group? Streptococci. Remember, linezolid lethal to strep. What potentially life-threatening drug interaction can occur when linezolid is co-administered with selective serotonin reuptake inhibitors? Remember, linezolid plus SSRI sparks storm. Name the glycylcycline antibiotic effective against MRSA and MDR Acinetobacter but contraindicated in pregnancy. Tigecycline. Remember, Tige tackles tough bugs. Which aminoglycoside is the drug of choice for plague caused by Yersinia pestis? Streptomycin. Remember, strepto strikes plague. Speak. Which macrolide is recommended as single-dose therapy for chancroid due to Haemophilus ducreyi? Speak. Azithromycin, 1 gram orally. Remember, azith one-shot chancroid. Binding of aminoglycosides requires what physicochemical condition in the bacterial periplasm that is blocked by acidic pH? Oxygen-dependent active transport. Remember, amino needs oxypol. Which tetracycline is preferred in renal failure because it is eliminated mainly via the gastrointestinal tract? Doxycycline. Remember, doxy dumps by digest. What dental adverse effect occurs in children exposed to tetracyclines during tooth development? Permanent yellow-brown tooth discoloration. Remember, tetra stains teeth yellow. Which 50S acting antibiotic class inhibits peptidyl transferase and is bacteriostatic against both gram-positive and gram-negative organisms, but limited by bone marrow toxicity? Chloramphenicol. Remember, chlor clips transferase. Resistance to macrolides is most commonly mediated by methylation of which ribosomal RNA component? 23S rRNA of the 50S subunit. Remember, 23S shields from macro. Which ketolide retains activity against many macrolide-resistant Streptococcus pneumoniae but carries risk of severe hepatotoxicity? Teliframycin. Remember, tele tackles tough strep. Name the streptogramin combination used intravenously for vancomycin-resistant Enterococcus faecium infections. Speak. Prosody rate 100%. Winupristin, dalfopristin. Remember, QD duo beats VRE. Which early sign mandates discontinuation of linezolid therapy due to risk of irreversible optic neuropathy? Blurred or decreased vision/visual field defect. Remember, linezolid look loss warning. Tetracyclines chelate which divalent cations, decreasing their oral absorption? Calcium, magnesium, iron. Remember, tetra traps calcium MgFe. Which antibiotic is preferred for treatment of community-acquired MRSA skin infection in outpatient setting? Speak. Prosody rate 100%. Doxycycline or clindamycin, except doxycycline. Speak. Remember, doxy defeats doorstep MRSA. Which aminoglycoside is specifically used in combination therapy for enterococcal endocarditis with ampicillin? Speak. Gentamicin. Remember, genta gears with amp. What once daily dosing property of aminoglycosides exploits their persistent antibacterial effect? Post-antibiotic effect, PAE. Remember, PAE permits single shot. Which tetracycline derivative is first line for scrub typhus caused by Orientia tsutsugamushi? Doxycycline. Remember, doxy scrub scrub. Which antibiotic class binds irreversibly to the 30S subunit, leading to misreading of mRNA and formation of non-functional proteins? Speak. Prosody rate 100%. Aminoglycosides. Remember, amino makes mRNA misread. Which macrolide is used as first-line therapy in non-gonococcal urethritis due to chlamydia trachomatis? Azithromycin single 1 gram dose. Remember, Izith clears clam quickly. In renal impairment, dosing of which macrolide needs no adjustment due to hepatic elimination? A speak. Prosody rate 100%. And also azithromycin. Remember, ERY exits via bile. Which tetracycline is ultra-long-acting, allowing once-weekly dosing for acne but is rarely used due to vestibular toxicity? Minocycline. Remember, Mino maybe makes motion mess. Mechanism of resistance to aminoglycosides most commonly involves enzymatic modification by which processes? Acetylation, adenylation, phosphorylation. Remember, AAP enzymes aren't bugs. Which rickettsial infection cannot be treated with sulfonamides because they worsen disease but responds dramatically to tetracyclines? Speak. Typhus fever, Rickettsia prowazekii, and speak. Remember, tetra rescues typhus. What potentially fatal adverse effect can occur when chloramphenicol is combined with bone marrow suppressants like zidovudine? As speak, prosody rate 100%, aplastic anemia. Remember, chlor plus AZT kills marrow. Which newer oxazolidinone has improved activity against linezolid-resistant staphylococci? Speak tedazolid, rate 100%. Remember, Teddy, tops line. Which tetracycline is part of the WHO Category A drugs for Helicobacter pylori eradication regimens? Speak prosody rate 100%, tetracycline plain. Remember, tetra terminates tummy bug. Which aminoglycoside is least nephrotoxic and is preferred in pregnancy for serious gram-negative sepsis? Spectinomycin is not nephrotoxic but not used. Safer, streptomycin, historically. Modern answer, amikacin still safer? Actually streptomycin autotoxic, nettlemycin least nephrotoxic, except nettlemycin. Remember, nettle mild on nephrons. Which macrolide can cause reversible ototoxicity at high intravenous doses used for Legionella pneumonia? Erythromycin. Remember, Ear Echo high dose. Triple response of newborns given tetracyclines includes stained teeth, inhibition of bone growth, and what third effect? Speak. A prosody rate 100%, hepatic dysfunction in mother-child fatty liver. Remember, tetra, triple, teeth, bone, liver. Which pleuromutilin antibiotic was recently approved for community-acquired bacterial pneumonia caused by macrolide-resistant strains? Speak, prosody rate 100%, lefamulin. Remember, lefamulin Long's lifeline. What is the recommended test interval for complete blood count during prolonged 14 days or linezolid therapy? Weekly CBC. Remember, linezolid labs weekly. Which aminoglycoside polypeptide combination is used topically for ocular infections under the brand name Neosporin? Speak with polymyxin B and bacitracin. Remember, Neo-Trio Eye Shield. Tigecycline should not be used for bloodstream infections because of what pharmacokinetic limitation? Speak, prosody rate 100%. Low serum concentrations, large volume of distribution, prosody. Remember, TEACH hides in tissues. Which macrolide is preferred in Mycobacterium avium complex prophylaxis in advanced HIV infection? Azithromycin weekly, azithromycin weekly. Remember, Izip wards MAC weekly. What is the maximum recommended cumulative dose of streptomycin to reduce risk of vestibular damage? Speak, prosody rate 100%, 100 grams total. Remember, strepto stop at 100 grams. Which adverse effect distinguishes telithromycin from other macrolides and led to usage restrictions? Severe hepatotoxicity and visual disturbances. Remember, tele troubles liver eyes. Chloramphenicol is still the drug of choice for which severe zoonotic infection in Himalayan regions of India? Enteric typhoid fever with complications or alternative. Actually, typhoid uses ceftriaxone, but rickettsial? Oops. High-yield, serious Salmonella typhi meningitis. NEET often. Chloramphenicol DOC for meningitis by H. influenzae in pen allergy. Let's pick brain abscess due to B. fragilis. Let's choose meningitis caused by Haemophilus influenzae when alternatives unavailable. Remember, chlor backs up Hib meningitis. Which tetracycline offers once-daily dosing because of enteral hepatic recycling and long T-half, approximately 65 hours? Doxycycline. Speak. Remember doxy daily, done. Speak. Prosody rate 100. Why are aminoglycosides ineffective in treating anaerobic infections like abscesses? Require oxygen-dependent uptake into bacteria. Remember, no O2, no amino. Which antibiotic causes red man syndrome when infused rapidly due to histamine release, though it inhibits cell wall, not protein synthesis? Speak. Vancomycin, not PSI, but note. Instead, speak. Remember, Vanco flashes red. Which oxazolidinone requires dose reduction in severe hepatic impairment? None. Linezolid cleared non-enzymatically. Tedazolid lacks data. Remember, oxazo liver light load. Aminoglycoside beta-lactam combination therapy demonstrates what type of antimicrobial interaction? Synergism. Remember, amino plus BL equals boom. Which macrolide has the greatest propensity to prolong QT interval and should be avoided with class IA antiarrhythmics? Speak. Erythromycin or clarithromycin, except erythromycin. Erythromycin. Remember, Eri extends QT. Tetracyclines impair efficacy of which family of antibiotics by chelation when co-administered orally? Fluoroquinolones. Remember, tetra traps quin. Linezolid inhibits protein synthesis by preventing formation of which ribosomal initiation complex? 70S initiation complex. Remember, linezolid locks 70 start. Which aminoglycoside is preferred for neonatal sepsis in resource-limited settings due to low cost and proven efficacy? Speak. Prosody rate 100%. Remember, Genta guards neonate. What laboratory parameter should be monitored twice weekly to detect chloramphenicol-induced bone marrow suppression early? Speak. The reticulocyte count, SPCB. Remember, chlor check retic. Which drug is used orally to decontaminate the bowel before colorectal surgery and is not absorbed systemically, acting on 30S? Neomycin. Remember, neo grooms gut pre-op. Concurrent use of tetracyclines with oral contraceptives may cause what therapeutic failure? Unintended pregnancy, reduced OCP efficacy, reduced. Remember, tetra tricks the pill. Which aminoglycoside shows the greatest activity against Pseudomonas aeruginosa and is often combined with piperacillin? Tobramycin. Remember, Tobra targets pseudo. What is the mechanism of action of mupirocin, a topical agent for MRSA nasal carriage? Inhibits isoleucyl tRNA synthetase. Remember, mupirocin blocks iso-tRNA. Which tetracycline is favored in leptospirosis prophylaxis after floods? Doxycycline weekly 200 milligrams. Remember, doxy dam flood defense. Clindamycin plus primaquine is an alternative therapy for which opportunistic pneumonia in HIV patients unable to take cotrimoxazole. Speak and prosody rate 100%, pneumocystis jirovecii pneumonia. Remember, Clinda and Prima punch PCP. Which aminoglycoside is used as an inhalational formulation for chronic Pseudomonas lung infection in cystic fibrosis? Tobramycin inhalation. Remember, Tobra mist for CF. High doses of erythromycin may cause cholestatic hepatitis by inhibition of which hepatic transporter? Bile salt export pump, BSEP. Remember, ERY blocks bile pump. Which tetracycline has additional anti-inflammatory properties used in rosacea management? Speak. Prosody rate 100%. Doxycycline sub-antimicrobial dose. Prosody. Remember, doxy dials down redness. Linezolid should not be given for more than 28 days, primarily to avoid which reversible hematological toxicity? Thrombocytopenia. Remember, linezolid lowers platelets. Macrolides exert a bactericidal effect against which intracellular pathogen responsible for whooping cough? Speak. Prosody rate 100%. Remember, macromose pertussis. Which aminoglycoside structure modification, addition of ethyl side chain, confers resistance to many adenyltransferase enzymes? Amikacin L-hydroxyaminobutyrylamide side chain. Remember, AMI armors itself. Which tetracycline should be taken on an empty stomach because food greatly decreases its absorption, unlike doxycycline? Speak. Tetracycline hydrochloride 202 EL is equal to. Remember, plain tetra prefers empty plate. What is the target trough serum concentration range for gentamicin in serious systemic infections to minimize toxicity? Less than 2 micrograms per milliliter. Remember, Genta keep trough under 2. Quinipristin and dalfapristin act synergistically because dalfapristin enhances binding of quinipristin to which ribosomal site? 50S exit tunnel, peptidyl transferase center. Remember, DAL opens door for Q. Which macrolide achieves the highest intracellular concentrations within phagocytes, facilitating delivery to infection sites? Azithromycin. Remember, azith amps inside cells. Aminoglycoside dosing should be based on which body weight parameter in obese patients? Adjusted body weight. Remember, amino uses AG weight. Chloramphenicol inhibits which mitochondrial ribosomal subunit in human cells, explaining its selective marrow toxicity? 70S mitochondrial ribosome, similar to bacterial 50S. Remember, chlor chills mito 70S. Which antibiotic class causes a concentration-dependent pulse chase inhibition of bacterial protein synthesis detectable on radiolabel assays? Steep aminoglycosides. Aminoglycosides. Remember, amino stop-start spike. Which tetracycline can be used as an oral chelating agent for SIADH-related hyponatremia because it blocks vasopressin action at collecting ducts? Speak prosody rate 100%. Demeclacycline. Remember, Demec dries dilution. Linezolid should not be mixed with which IV fluid due to precipitation issues? Normal saline with added electrolytes, but clinically avoid calcium-containing solutions, LR. Remember, linezolid loves plain D5. Which aminoglycoside is preferred for tularemia caused by Francisella tularensis? Speak, prosody rate 100%, streptomycin or gentamicin, CDC, streptomycin. Remember, strepto stops tularemia. Which macrolide shows immunomodulatory effects by decreasing interleukin 8 and is used in diffuse panbronchiolitis? Erythromycin low dose. Remember, ERI calms cytokines. High doses of tetracycline are avoided because of increased risk of what mortality-related adverse event? Severe treatment-emergent sepsis, higher all-cause mortality. Remember, TIG at top dose, tragic. What coagulation abnormality can chloramphenicol precipitate by depressing vitamin K producing gut flora? Speak, prosody rate 100%, prolonged prothrombin time, hypoprothrombemia. Remember, chlor cuts clotting. Which antibiotic combination is recommended by WHO for neonatal conjunctivitis due to chlamydia? Oral erythromycin syrup, 50 mg per kilogram per day for 14 days. Remember, ERI eyes newborn. Aminoglycosides exhibit what pattern of bacterial killing related to increasing drug concentration? Speak, prosody rate 100%, concentration-dependent killing. Remember, higher amino hits harder. Which pregnancy category is assigned to tetracyclines by US FDA? Speak, category D. Hey. Remember, tetratag D danger. At what serum creatinine level, mg per deciliter, should gentamicin dosing interval be extended to 48 hours in adults? Speak to the prosody rate 100%. Remember, CR2 delay Genta. Which macrolide has the longest elimination half-life, 68 hours, enabling once-daily regimens of 3 to 5 days? Azithromycin. Remember, azith stays almost weak. Telithromycin is contraindicated in myasthenia gravis due to risk of what crisis? Respiratory failure, myasthenic crisis. Remember, tele triggers tired muscles. Linezolid is active against which VAN gene-mediated resistant enterococcal phenotype? Speak, prosody rate 100%. Vanna type VRE. Remember, linezolid lands on VAN A. Which aminoglycoside is delivered intrathecally for gram-negative meningitis unresponsive to other therapy? Speak, prosody rate 100%, gentamicin preservative-free. Remember, Genta into CSF, last hope. Chloramphenicol is metabolized primarily by which hepatic conjugation reaction in adults? Speak prosody rate 100%. Glucuronidation by UGT2B7. Remember, chlor gets glued glucuronide. Which tetracycline derivative is specifically designed to overcome efflux pump resistance in Acinetobacter and Enterobacteriaceae? Eravacycline. Remember, Erava evades efflux. A combination of azithromycin with hydroxychloroquine in early COVID-19 trials was abandoned mainly due to which adverse cardiac effect? QT interval prolongation leading to torsades de Puentes. Remember, azith plus HCQ, twist QT. Which protein synthesis inhibitor class is concentration independent, time dependent, requiring frequent dosing to maintain efficacy? Speak prosody rate 100. Beta-lactams actually, for PSIs, macrolides and clindamycin, time dependent. Remember, macro needs clot coverage. Which aminocyclitol antibiotic is used mainly for gonorrhea in cephalosporin allergic patients but not available in India? Spectinomycin. Remember, Specti spares shot of Ceph. Which oxazolidinone has once daily dosing due to higher potency and longer half-life compared with linezolid? Speak tadalafil. Remember, Teddy taken one time. Co-administration as calcium supplements should be separated by how many hours from doxycycline dosing to avoid chelation? At least 2 hours. Remember, 2-hour tetra rule. Clindamycin resistance in Bacteroides fragilis is due to methylation of what ribosomal locus, gene? Speak. Prosody rate 100%, 23S rRNA methylation. Speak. Remember, ERM edits 23C. Which aminoglycoside should be avoided with loop diuretics to minimize synergistic ototoxicity? Ithacrinic acid plus any aminoglycoside, specifically avoid furosemide with gentamicin. Remember, furosemide fuels ear damage. Which tetracycline is first line for malaria prophylaxis in areas with chloroquine resistance when mefloquine cannot be used? Doxycycline. Remember, doxy defends against malaria. Linezolid has weak MAO inhibitory action. Patients should avoid large amounts of which food component? Tyramine-rich foods, aged cheese, etc. Remember, linezolid low tyramine. Which once-daily macrolide analog lacks prokinetic motilin stimulation and therefore causes less GI cramping? Azithromycin. Remember, azith avoids gut gripes. Which antibiotic class is contraindicated in myasthenia gravis because it can exacerbate muscle weakness via presynaptic blockade? Aminoglycosides. Remember, amino aggravates MG.